I scroll down, we can identify the appendix right by the arrow here. It's arising from the cecum, which is right here, and the appendix is right here. It's a blind ending tubular structure, so we can follow that, and I put arrows on either side of it, so you can see it's this tubular structure right here. It's filled with fluid, and it's blind ending. If I keep scrolling, you can see we lose it. So appendix between the arrows, extending up till here. This is the tip right here, and then it's gone. So blind ending tubular structure arising from the cecum. In this case, we can see that there's periappendiceal stranding. So that's this gray, wispy looking stuff here, which makes the fat look a little bit dirty, as I've mentioned in some of our previous videos. Contrast that with the what we call clean fat, which is dark, there's no stranding. This is stranding, that gray kind of wispy looking stuff. And you can see there's some fluid kind of around the appendix too. So remember, this was appendix, that circular tubular blind ending structure, and that the gray around it is a little bit of fluid, which is another sign of inflammation. So I'm going to go ahead and put an arrow on that. Right there. So that's an example of stranding. One other unique aspect in this case is that this is a retrocecal appendix. So you can see as I'm scrolling back and forth that it arises, the appendix is right here, it's arising from the cecum, but it's coursing posteriorly behind the cecum. This can sometimes make it tricky to identify the appendix. Something that's helpful for me is to look at it on sagittal. And if I go on sagittal, you can see that here's the appendix again. So I'll scroll through once. Let's see if you can see it. And so hopefully you're able to see it, but it's right here. I'm going to put some arrows on the course of the appendix as I scroll one more time. So now as we scroll, we can see the arrows delineating the blind ending tubular structure arising from the cecum, and in this case coursing posterior to the cecum, since this is a retrocecal appendix with a blind ending tip right here. And there's also some surrounding inflammatory stranding, such as right here, what I'm outlining with my cursor. So that's a sign of appendicitis. So on CT, you'll see a dilated appendix, which is fluid filled. Sometimes you'll see an appendicolith, which will often show up as a radiodensity within the lumen. You'll see wall thickening, and you'll see periappendiceal inflammation, which manifests as fat stranding and fluid surrounding the appendix.